The GE LOGIQ E10 has a number of ergonomic features that will help you maintain more neutral scanning postures. It has electrically controlled control panel swivel and height. These controls will allow you to raise the system up so that you can stand to scan and bring it down while you're seated or if you're doing venous reflex exams. The controls for the swivel of the control panel allow you to make small adjustments while you're scanning and whenever you want to change your position to the patient. You should always position the control panel so that the most frequently used keys are directly under your typing hand. And in this system, those keys are centered around the trackball, making it easy to reach everything without an extensive arm reach. The knobs on the control panel are actually toggle switches that you can manipulate without having to use a pinch grip to turn them. The monitor is on an articulated arm, which gives it a lot of adjustability. It can swing out so that you can position it at the right height for your eyes and to avoid any neck twisting, flexion, or extension. It has multiple adjustments and it can tilt towards you and flat for when you take it to the floors on portable exams. The system also has an additional feature. It has these storage bins, which you can put items in when you transport the system, but also it allows you to keep things off of the console so that you do have freedom to move the control panel and the monitor. Another feature of this system is the foot pedal. The foot pedal can control the freeze and imaging portion of your exam. This is an interesting feature because it's something that can contribute to worker returning to work activities. So an injured worker who comes back can actually reduce their arm motions and arm reach by using the foot pedal to freeze and capture images. The system is also compatible with a remote control tablet. So there are many features that you can control from the tablet, and this makes it easier for you to do certain exams that might create a lot of reach, such as venous reflex exams where you're seated quite low and you'd have to reach for the control panel, or carotid exams from the head of the table. By using all the ergonomic features of the system, you can minimize your risk for injury and scan more comfortably. But remember, the ultrasound system is not the only component in a workstation. Your room also contains a chair and an exam table, so you want to make sure they all three work together and that you use the features of all three of them.